carcinoma cheek and buccal sulcus, gingivobuccal sulcus. Okay, it is together called as carcinoma gingivobuccal complex. Okay, because it is very common in India. The buccal mucosa and gingiva cancer is taken together. It is called as carcinoma gingivobuccal sulcus or gingivobuccal complex. If it is isolated to the cheek, it is carcinoma buccal mucosa. Okay, so it's very specific to Indian population and it should be known in detail. This is a very common case to be kept in exam. Okay, so what are all the things to be learnt about carcinoma buccal mucosa or gingivobuccal complex? It is commonly called as Indian oral cancer. Tongue cancer is Western oral cancer. Buccal mucosa is Indian oral cancer. It is most common in India only. The main causative factor is chewing and keeping of the chewed tobacco quid inside the GB sulcus. Chew the betel quid, betel leaf and this palm, and the semi-solid quid is kept inside the GB sulcus. We have already discussed in detail regarding quid. Everything should be written here. If this question comes in the exam, everything should be written here. Carcinoma, GB sulcus, you have to write everything about quid. Okay. Coming to the anatomy, any malignancy, you have to describe the anatomical extent of the organ. Buccal mucosa includes all the mucosal lining from the inner surface of the lips and the commissure to the posterior most attachment of the mucosa to the alveolar ridges and the pterygomandibular raphe. So, this is anterior, this is posterior, maxilla, mandible. This is buccal mucosa. From the commissure to the posterior attachment to the bones or the gingiva, and here there will be pterygomandibular raphe, that is from the pterygoid plate of the sphenoid bone, mandible will be attached here. Up to this extent will be the posterior extent. Anteriorly will be the commissure. Posteriorly will be the pterygomandibular raphe. Okay, this is the extent of the buccal mucosa. What are all the layers of the buccal mucosa? Very important, will be asked in the exam. From inside to outside, what are all the layers? Buccal mucosa, pharyngobasilar fascia, buccinator muscle, buccopharyngeal fascia, buccal fat of fat, masseter muscle, muscles of facial expression, and the superficial musculoponeurotic system, and following which there will be subcutaneous tissue and skin as the outermost component. Okay, so at least clearance should be given up to this layer. This is what the clinical aspect of this topic is. I mean the layers is. If there is a lesion in the buccal mucosa, clearance should be given up to buccinator muscle. Okay, buccal mucosa, pharyngobasilar fascia, buccinator muscle, all three should be removed. Only this buccopharyngeal fascia and buccal pad of fat should be visible. Okay, the rest of the structure should be removed from inside out. Okay, how does a carcinoma cheek spread? It invades into the layer of cheek and comes outwards. From inside, it comes outwards, causing fungation or ulceration and orocutaneous fistula formation, causing fungation or ulceration and orocutaneous fistula formation. It extends anteriorly to the commissure. Posteriorly, it extends to the retromolar trigone. It extends deep into the masticator space. Once it enters the masticator space, it will invade the muscles of mastication and patient will have trismus. Okay, and it can also invade the pterygoid plate, which will constitute T4B lesion. It will also invade the pterygoid plate, which will constitute T4B lesion. Okay, it can easily extend into the mandible or gingival mucosa, leading to extensive surgeries. Okay, see, buccal mucosa is just above the mandible. Mandible will be here, buccal mucosa will be like this. Okay, so tumor here will easily extend into the mandible. Okay, so once it extends to the mandible, we have to remove the mandible also, no other go. Okay, we have to remove the mandible, no other go.